Welcome to the Morning Huddle. Before we begin rounds, we need to address the primary cause of avoidable resident hospitalizations in this facility: healthcare-associated infections. Pathogens are a moving target. On a single contaminated surface, bacteria can multiply thousands of times in a few hours, moving from bed rails to doorknobs to the residents themselves. To interrupt that cycle, we rely on a foolproof infection control checklist, a set of non-negotiable steps that act as our... Today, we're focusing on 3 critical zones of that routine: hand hygiene triggers, safe laundry handling, and the management of high-risk tasks. Mastering these steps ensures that pathogens are neutralized before they can cause the systemic infections that lead to emergency room transfers. Standard precautions begin with a strict 20-second wash using soap and water, or a thorough application of an approved alcohol-based rub. Our hand-washing checklist has 6 specific mandates. The first trigger occurs every time you use the toilet. Second, you must wash before any direct contact with a resident, before dispensing medications, and before handling food. Third, wash immediately after contact with any body fluids, such as blood, urine, or wound drainage. Fourth, wash your hands after handling potentially contaminated objects, like used basins or bed linens. Fifth, you must wash between direct contact with different residents to prevent carrying pathogens from one room to the next. Many staff members fall into a safety trap known as the glove illusion, the belief that gloves alone are a sufficient barrier. This leads to our 6th and most frequently missed trigger: you must wash your hands immediately after removing your gloves. Because gloves are porous and can fail during use, skipping this final wash makes them a primary vehicle for pathogen transfer throughout the facility. Proper infection control also extends to how we handle the physical environment, specifically our protocol for managing soiled linens. Before touching any soiled laundry, you must don an impervious gown and impervious gloves to protect your uniform and skin from saturation. Avoid the laundry hug, the habit of holding sheets against your body. Shaking or hugging linens creates a burst of airborne particles that spread contamination. Instead, roll the linens inward, keeping the soiled side contained. Once rolled, place the laundry directly into a secured, impervious bag to prevent any fluid spillage or further contact during transport. A successful protocol results in a clean, dry uniform and a disposal bag that is tightly tied off before it leaves the resident's room. Containing these materials at the source directly breaks the chain of facility-wide contamination. We apply this same logic to high-risk daily tasks, particularly when preventing catheter-associated urinary tract infections, or CAUTIs. Bacteria enter the bladder through 2 routes. Extraluminal transfer occurs when microbes climb the outside of the catheter tube, while intraluminal transfer happens inside the tube if the closed system is ever broken. To prevent extraluminal spread, ensure the urinary drainage badge never makes contact with the ground, as floor contact provides a direct path for colonic bacteria to migrate upward. During pericare, always use a strict front-to-back wiping motion. This physical direction is necessary to keep bacteria away from the urinary tract. By maintaining a closed, elevated system and executing correct hygiene techniques, you create a physical blockade against severe urinary infections. Today, we've covered the 3 pillars of a high-functioning infection prevention routine. Use this huddle to verify your goals. Memorize the 6 hand hygiene triggers, roll your laundry away, and keep drainage bags off the floor. Before you head to your first resident, please grab a copy of the hand hygiene checklist from the break room wall. These habits are the most effective tools we have to prevent the spread of disease and ensure our residents remain safe under our care. Let's get started.